out of the gates, supplement-wise, there's a lot of medications out there. There's primarily two families of medications that are out there. They're going to be things like the finasteride family, whether it's finasteride or dutasteride, which are going to be 5-alpha reductase inhibitors, primarily type 2. Dutasteride is type 1 and type 2, but that's besides the point. And then you're going to have growth stimulators, the major one being Rogaine or minoxidil. And that's more of a stimulator, vasodilator, growth stimulator. So those are the two big families of medications. And so the number one big theory in regards to hair loss is the DHT. DHT helping to improve. DHT is a dihydrotestosterone. It's a stronger form of testosterone that's more of a metabolite that's downstream, and that essentially can pinch off blood flow to prevent prevent the hair from getting good nutrition and blood flow. And then over cycles as the hair falls out, and then you have a new telogen anagen phase. Anagen is the growth phase, telogen is the resting phase. So when you have this new telogen phase where that hair is resting, the follicle begins to miniaturize over time. So this DHT becomes a problem. That's kind of one of the big theories out there. And it's definitely real. It's definitely legit because there's too many people out there and tons of data out there on finasteride medications having success, but it's not a be all or end all for everyone. Why is that? There's a lot of other potential causes, whether it's different genetic things, the receptor site sensitivity on the 5-alpha reductase type 2, whether it's chronic inflammatory components, autoimmune components, nutritional issues. There's other issues, but we definitely want to give credence to this 5-alpha reductase inhibitor in the DHT kind of philosophy, because there's definitely something to it. There's too many people that have reported benefits and results on that front. So we have the finasteride kind of family. We have this DHT blocking effect. We have the growth stimulation effect. And then we have different nutrients that can play a major role. And then we have this chronic inflammatory mechanism, which we'll talk a lot about that in a minute. Chronic inflammation, especially at a lower grade, can definitely inhibit blood flow, can definitely inhibit nutrition. Again, if you're chronically inflamed, there's probably inflammatory food coming in, excess sugar, polyunsaturated fatty acids, processed flours and grains, probably a lack of nutrients coming in with those foods as well. So you have to look at everything on both sides of the fence here. And having, over 10 years of experience dealing with patients where hair loss is a top complaint, it's really important to look at it. And then we have the telogen effluvium, which is going to be a systemic hair loss. You're going to see more of the androgenic alopecia, the male pattern baldness with men. Women can still have it, still a similar mechanism, but you're going to see more of the telogen effluvium. This is going to be more of a systemic hair loss across the whole scalp, usually due to stress, surgery, post-viral illness. These are all common things that can drive a lot of that. And that's more of a systemic hair loss, where the male pattern baldness is going to be more in the hairline here and the vertex in the crown here. That's where you're going to see it first. It's going to go here to here. So we'll get into the supplements in a second. So I want you guys to think about the mechanism. We have the growth stimulation on the Rogaine. We have the finasteride, which is the 5-alpha reductase inhibitor. That's all about lowering DHT. DHT decreases blood flow, and it causes the follicle to miniaturize and get smaller and smaller and smaller, and then eventually fall out.